A client is diagnosed with cancer and is told that surgery, followed by chemotherapy, will be necessary. The client states to the nurse, "I have read a lot about complementary therapies, do you think I should try any?" The nurse should respond by making which appropriate statement? A. I would try anything that I could if I had cancer. B. You need to ask your health care provider about it. C. No, because it will interact with the chemotherapy. D. Let's talk more about the different forms of complementary therapies. The correct answer is D. Let's talk more about the different forms of complementary therapies. Rationale: complementary therapies include a wide variety of treatment modalities that are used in addition to conventional treatment to treat a disease or illness. These therapies complement conventional treatment, but they should be approved by the person's healthcare provider to ensure that the treatment does not interact with prescribed therapy. Option D addresses the client's question and encourages discussion. Question 2. The nurse is preparing to assist a client of Orthodox Jewish faith with eating lunch. A kosher meal is delivered to the client. Which nursing action is appropriate when assisting the client with the meal? A. Unwrapping the eating utensils for the client. B. Replacing the plastic utensils with metal utensils. C. Carefully transferring the food from paper plates to glass plates. D. Allowing the client to unwrap the utensils and prepare his own meal for eating. The correct answer is D. Allowing the client to unwrap the utensils and prepare his own meal for eating. Rationale: kosher meals arrive on paper plates and with plastic utensils sealed. Healthcare providers should not unwrap the utensils or transfer the food to another serving dish. Although the nurse may want to be helpful by assisting the client with the meal, the only appropriate option for this client is option D. Question 3. The nurse is caring for a group of clients who are taking herbal medications at home. Which client should be given instructions regarding avoiding the use of herbal medications? A. A 60-year-old male client with rhinitis. B. A 24-year-old male client with a lower back injury. C. The mother of a 10-year-old child with a urinary tract infection. D. A 45-year-old female client with a history of migraine headaches. The correct answer is C. The mother of a 10-year-old child with a urinary tract infection. Rationale: children should not be given herbal therapies, especially in the home, and without professional supervision. There are no general contraindications for the clients, described in options A, B, and D. Question 4. The client asks the nurse about various herbal therapies available for the treatment of insomnia. The nurse should encourage the client to discuss the use of which product with the healthcare provider. A. Garlic. B. Valerian. C. Lavender. D. Glucosamine. The correct answer is B. Valerian. Rationale: valerian has been used to treat insomnia, hyperactivity, and stress. It has also been used to treat nervous disorders, such as anxiety and restlessness. Garlic is used as an antioxidant and to lower cholesterol levels. Lavender is used as an antiseptic and fragrance for a mild sedative effect. Glucosamine is an amino acid that assists with the synthesis of cartilage. Question 5. The nurse is assisting with collecting data from a client admitted to the ambulatory care unit who is scheduled for a hernia repair. Which information about the client is of least priority during the data collection? A. Respiratory. B. Psychosocial. C. Neurological. D. Cardiovascular. The correct answer is B. Psychosocial. Rationale: the psychosocial data is the least priority during the initial admission data collection. Respiratory, neurological, and cardiovascular data include physiological assessments that would be the priority. Question 6. The nurse is caring for a client after a thyroidectomy and notes that calcium gluconate is prescribed for the client. The nurse determines that this medication has been prescribed for which reason? A. Treat thyroid storm. B. Prevent cardiac irritability. C. Treat hypocalcemic tetany. D. Stimulate the release of parathyroid hormone. The correct answer is C. Treat hypocalcemic tetany. Rationale: hypocalcemia can develop after thyroidectomy if the parathyroid glands are accidentally removed or injured during surgery. Manifestations develop 1 to 7 days after surgery. If the client develops numbness and tingling around the mouth, fingertips or toes, or muscle spasms or twitching, the healthcare provider is notified immediately. Calcium gluconate should be accessible for the client who underwent thyroidectomy. Question 7. The healthcare provider prescribes exenatide, Byetta, for a client with type 1 diabetes mellitus who takes insulin. The nurse knows that, which is the most appropriate intervention? A. The medication is administered within 60 minutes before the morning and evening meal. B. The medication is withheld, and the HCP is called to question the prescription for the client. C. The client is monitored for gastrointestinal side effects after administration of the medication. D. The insulin is withdrawn from the penlet into an insulin syringe to prepare for administration. The correct answer is B. The medication is withheld, and the HCP is called to question the prescription for the client. Rationale: exenatide, Byetta, is an incretin mimetic used for type 2 diabetes mellitus only. It is not recommended for clients taking insulin. Hence, the nurse should hold the medication and question the HCP regarding this prescription. Although options A and C are correct statements about the medication, in this situation the medication should not be administered. The medication is packaged in pre-filled pens ready for injection, without the need for drawing it up into another syringe. Question 8. The client with myasthenia gravis is suspected of having cholinergic crisis. Which sign or symptom indicates this crisis is taking place? A. Ataxia. B. Mouth sores. C. Hypothermia. D. Hypertension. The correct answer is D. Hypertension. Rationale: cholinergic crisis occurs as a result of an overdose of medication. Indications of cholinergic crisis include gastrointestinal disturbances, nausea, vomiting, diarrhea, abdominal cramps, increased salivation and tearing, meiosis, hypertension, sweating, and increased bronchial secretions. Question 9. The client is receiving meperidine hydrochloride, Demerol, for pain. Which are side/adverse effects of this medication? Select all that apply. A. Diarrhea. B. Tremors. C. Drowsiness. D. Hypotension. E. Urinary frequency. F. Increased respiratory rate. The correct answers are B. Tremors, C. Drowsiness, and D. Hypotension. Rationale: meperidine hydrochloride is an opioid analgesic. Side/adverse effects include respiratory depression, drowsiness, hypotension, constipation, urinary retention, nausea, vomiting, and tremors. Question 10. Ibuprofen, Advil, is prescribed for a client. Which instructions should the nurse give the client about taking this medication? A. Take with 8 ounces of milk. B. Take in the morning after arising. C. Take 60 minutes before breakfast. D. Take at bedtime on an empty stomach. The correct answer is A. Take with 8 ounces of milk. Rationale: ibuprofen is a nonsteroidal anti-inflammatory drug